You're listening to Bark and Wag's 15-Minute Vet Talk. Each week, your host, Polly Requa, interviews veterinarians and individuals in the pet industry from across the nation answering pet questions. Bark and Wag podcast is produced weekly for your enjoyment, and show notes can be found at barkandwag.com under the podcast tab. That's BARKNWAG.com. Please remember to subscribe to Bark and Wag 15-Minute Vet Talk.
Thank you for listening to Bark and Wag 15-Minute Vet Talk. Bark and Wag is dedicated to protecting our dogs through advocacy, education, and supporting like-minded dog lovers by selling custom pet products. Bark and Wag is excited to announce our new partnership with a Colorado hemp farm to produce a line of CBD products for your pets. Bark and Wag has CBD pet tincture available in 300, 750, 1200, and 2400 milligrams. Bark and Wag CBD is pet safe, no THC, it's made in the USA, and is CO2 extracted. Please check out Bark and Wag's website, barkandwag.com. That is BARK, to see our line of CBD and awesome merchandise. We love pooch ideas for podcasts and merchandise, so anytime send an email to Polly at barkandwag.com with your suggestions.
Welcome to Bark and Wag 15-Minute Vet Talk. I'm your host, Polly Requa. Today we're talking to Dr. Laura Brown, owner of Green Tree Veterinarian Clinic in Libertyville, Illinois. Welcome back to the podcast, Dr. Brown. I wanted to find out, what is a mast cell tumor?
Okay. Hey, Polly. So a mast cell is M-A-S-T. Cell tumor is a really common, usually a skin tumor in dogs. There's grades of mast cell. Probably 80% of them are benign, but 20% of them, and maybe less, 20% can be pretty malignant and aggressive. So what happens is they pop up on your dog's skin, sometimes under the skin, sometimes pops through the skin, and they look like anything. We call them the great imposter because they can look like any little skin growth thing. And the way you tell what they are is we take a needle and suck out a few cells and spread it on a slide and look under the microscope. And we can usually easily see right there in the office that we're worried that they're mast cells. The thing is, you can't tell from that little sample whether they're benign or malignant. So the next step is to take them off surgically and then send the whole thing in for a biopsy, like a histopath. And that's where the grading comes in. So grading is where they tell you if it's a grade 1, a grade 2. Those are the more benign ones versus 3 or 4s. Those are the not so benign ones and can get pretty worrisome. And the other thing they tell you from the histopath is whether you got the whole thing off with surgery. So they can check the margins and make sure the margins are clean. So with mast cells, the tricky part becomes the surgery, depending on where they are on your dog's body, because we always try and take them off with at least 2 centimeter margins. So if you think about how 2 centimeters is not super big, but if it's on your dog's leg, there might not be 2 centimeters of skin to take it off and then still close it up and have a closed up incision and not leave this big open ugly wound.
Right.
So that's the, like I said, 80% of them are benign, and the kind that are smaller and stay there for a long time without much changing are probably more in the benign family, but you really can't tell until you surgically remove it, which is the hard part. It involves a surgery to get them off and find out, how bad they are.
And so if they're benign, why do you have to, if you take the needle and find out that there aren't any cancer cells, why do they have to be removed?
So the needle tells you that there at least are mast cells there. So
I see.
When you see the mast cells, you go, I know this is a mast cell tumor. That's too small of a sample to decide about benign or malignant.
And what's the difference between a fatty tumor and a mast cell?
So when you do a fine needle aspirate of a fatty tumor, when you look under the microscope, all you see is fat cells. And those are benign, and they're usually under the skin. Like they don't pop through. Mast cells can be under the skin too. That's why it's important to take a fine needle aspirate of new lumps and bumps on your dog. The lumps and bumps that have been aspirated in the past that have thought to be lipomas, which are the fatty ones, and also super common. Usually dogs that have lipomas have more than one. They don't change a ton. They grow a little bit, but any lump or bump that anytime they're new, they need to be a fine needle aspirate to check and see if the cells, because that's easy, right? Fine needle aspirates, you can hold your dog. It takes 5 seconds for the vet to take a sample and get some cells out on the slide. It's a really small sample. So it's not completely diagnostic, but you can get some information about what's going on there. And then you watch the lump. So if any lump, whether it's a mast cell or a lipoma, changes in shape, changes in firmness, changes in size, the dog starts to bug it. Those all need attention, whether they're mast cells or lipomas. And the attention is to get them off so they stop bugging the dog, and then they're off, and then you can find out for sure whether they're benign or malignant. But mast cells typically aren't as big as lipomas. Lipomas can get ginormous, right? Like, I think, did Maddie have a big lipoma? One of your dogs?
Is that fatty?
Yeah. Lipomas are fatty ones.
She's a lot of them, but they're smaller.
Yeah, but a lot of them, and she's a lab, so that's common in the larger breeds. And so if you took her to surgery for every lump she had, that would be ridiculous, right? There's too many. But they all feel similar, right? They're all kind of movable. They're all under the skin. They're all pretty symmetrical, like you can feel their margins. They're not hard, like a rock hard. They're not attached down. And if you had an aspirate and you know they were fatty to start with, not that they, once again, back to that, then you keep an eye on those. You don't take them all to surgery. But the lumps that change and that once at one point they were soft and kind of squishy are now really hard and not attached down, those aren't still probably a lipoma. And sometimes when you take an aspirate, because the sample is so small, you may not get the right cells, especially on a bigger mass, and you may not know for sure what you got. That's why when you find a lump or bump that's changing, no matter what the fine needle aspirate said, it needs to come off for a biopsy. And a biopsy is the whole thing. A big chunk of tissue goes off to the lab so they can get a good representative sample of what that thing might be.
And if you have a mast cell tumor, does it indicate that you have cancer?
The lump itself might be cancer, but it may be a low enough grade that surgery is the cure. One surgery and done, and never have to look back again. That's what about 80% of them are. Okay. You get them off, you get good wide margins, and you're done. And they're considered low grade. Okay. So it depends on your terminology. I suppose somebody might, depending on who you talk to, low grade doesn't necessarily equal benign. It just means it was a low grade tumor and it's all removed, and those behave kind of benignly because they don't come back, they don't spread, and you're done. Okay. So some of it's terminology.
Okay. Great. Well, thank you for explaining it, and I look forward to having you back on the podcast.
Thanks, Polly. I'll talk to you again.
Thank you for listening to Bark and Wag's 15-Minute Vet Talk. If you like what you just heard, we hope you'll pass along our web address, www.barkandwag.com, to your friends and other pet owners. Have a pressing question for a veterinarian? Ask your question at barkandwag.com under the podcast tab. This has been a KFR production. Join us next time for another edition of Bark and Wag's 15-Minute Vet Talk.